Stretching is important because it increases extensibility of the muscles and connective tissues, burns body fat, improves joint health, prepares muscles and joints for exercise, therefore preventing injury. It improves agility, relieves ache, pains, and muscle cramps, improves body position and strength. Depending on the time you stretch, it can also help you get rid of lactic acid in the muscle. It helps maintain good posture and balance, and it helps maintain a good range of motion. Without stretching, your muscles shorten and become tight. Therefore, when you go to use them, they are weak and will not be able to extend all the way. The myostatic stretch reflex is a reflective mechanism to protect the body from overstretching and tearing the muscle. You have these proprioceptors called muscle spindles that wrap around the muscle and sense the distance and velocity of a stretch. If a muscle is stretched too much, the muscle spindles send a message to the spinal cord, which then send a signal back to the muscle telling it is under too much pressure and to quickly contract back to a normal neutral position. The inverse myostatic stretch reflex is the opposite of the myostatic stretch reflex. It involves the Golgi tendon organ as a proprioceptor that is located at the muscle tension junction, and it senses when there is too much tension in the muscle. If the Golgi tendon senses too much tension, it sends a message to the brain notifying its current condition, and the brain will then send back a message to the muscle telling it that there's too much tension in that muscle and to relax immediately to prevent injury. Stretching is often overlooked. However, it is very important for the body improvement. If you do not want to waste your time, focus on the chronically tight muscles and the major ones you've worked in your workout, and stay away from chronically elongated muscles as they are already stretched out enough and need to be strengthened instead. Here are some of the muscles that always seem to be tight for the average person, and the execution of the stretches to relieve the tightness. Remember to maintain good posture throughout each stretch. The chest should be up and lifted, the scapula retracted and depressed, the core contracted, and the spine in neutral. The action of the anterior deltoid is to flex the shoulder. Therefore, in order to stretch this muscle, the shoulder must be in extension. Stand up straight, keep your shoulders down and your chest up, hold your hands together behind your back, and gently pull the arms upwards. You should feel this in the front of your shoulders. The pectoralis major is a very large muscle with a very big range of motion, and it is very important to stretch this one because it's often tight, and if it's tight, it can cause rounding of the shoulders. Stand up straight, pull your arm back to shoulder height, and bend the elbows to 90 degrees. Then pull your elbows back as if you were trying to get them to touch together. If you want more of an intense stretch, push slightly against a doorway or an object. You should feel this across your chest. The rectus abdominis flexes the spine, therefore it needs to be extended in order to feel a stretch. Start with your hands and knees on the floor, knees directly under hips, wrists directly under shoulders. Begin with a neutral spine, then lift your head and tailbone to the ceiling. Make sure you do not strain the neck and hyperextend the back too much. You should feel this all the way down your stomach. The iliopsoas is often a very tight muscle because it's usually worked with every step you take, and unconsciously during ab exercises. Because it flexes the hip, you must extend it in order to get a good stretch. To start this one off, go into a lunge position, making sure the hips are square. Put your hands on your knees and press the hips into the floor. The knee of the front of the leg should never go over the toes. Hold for 30 seconds or more, and then switch legs. Make sure the chest is up and lifted and the scapula is retracted and depressed throughout the entire exercise. The quadriceps femoris is made up of 3 muscles: the rectus femoris, vastus medialis, and the vastus intermedius. These muscles need to be stretched as they can get quite tight. Kneel into a lunge position, making sure the front of the knee is at a 90-degree angle. Once you are stabilized, grab the foot that's behind you and gently lift it to your glutes. You should feel a nice stretch all throughout your quads. If you need a more intense exercise, lean deeper into the lunge, but never allow the knee to go over the toes. The superior trapezius does not have necessarily need to be worked, but it does often become tight, so it must be stretched. You can either stand up or sit down in a chair for this stretch. Simply start by pulling your head forwards and downwards towards your armpits. If you need a bit more intensity, gently put your hand on your head and pull in the same motion. You should feel a nice stretch in your upper trapezius between the rhomboids and the posterior deltoids. The biceps brachii are responsible for flexion of the elbow. Therefore, you need to extend the elbow to stretch it. Stretch your arm out in front of you and bend your wrist so your fingers are pointing down. Take your other hand and gently push down on the wrist. You should feel this right in your biceps. The erector spinae muscles hyperextend the spine. Therefore, they must be flexed to be stretched. Kneel down and drop your glutes to your heels as you stretch the rest of your body down and forwards. Reach your arms above your head, your stomach and chest on the top of your thighs, and your forehead on the floor. You should feel a slight stretch in your lumbar area and gradually up your spine. The quadratus laborium is a deep muscle in your lumbar area, and since it's worked every time you take a step, it can often become tight. To stretch this muscle, lie on your back, extend your arms above your head, grasp your wrists, and cross one leg over the other. Bring your spine into lateral flexion, but make sure you keep your hips and shoulders on the floor at all times. You should feel this stretch deep in your lumbar area. Here's a bit of a better view on the position you need to be in for this stretch. The hamstrings tend to be a very tight muscle. One way to stretch the hamstrings is to lie on your back. Grab wherever your hand can reach and stretch the leg up. keeping both knees straight and the foot in the air flexed. Gently pull the leg to the chest. To intensify the stretch, grab a little higher on the leg. The gastrocnemius flexes the knee and plantar flexes the ankle. Therefore, you must do the opposite action to stretch this muscle. Stand with the ball of your foot on the step and drop the heel down slightly until you feel a stretch in your calves. If you want to make sure the stretch focuses solely on the gastrocnemius, you must keep your knees straight. The soleus is responsible for plantar flexion of the ankle as well, but only when the knee is bent. Set up the exact same way as you would a gastrocnemius stretch, but this time have a slight bend in the knees and it will focus more on your soleus.